Welcome, listener, to Have More Babies. This is where we take the sources you send us and really get into them, pulling out the key insights. Today, we're tackling something that definitely causes parental stress: strep throat. We're going to unpack how pediatricians actually make that diagnosis. We got a great source from Omega Pediatrics. To strep or not to strep? It really digs into this common dilemma. Our mission: cut through the noise, help you understand what doctors are really looking for, make you a more informed partner in your kid's health.
Exactly. Strep throat, streptococcal pharyngitis, it's super common. And, it drives a lot of antibiotic prescriptions for kids. So understanding how it's diagnosed is, well, it's crucial, not just for doctors, but for you as parents, too.
Okay, let's get into it. A kid has a fever, sore throat, boom, parents often think strep. And there's a solid reason for that concern.
Right. Absolutely. A strep diagnosis means a few key things. One, it's a real bacterial infection. Two, it's contagious. Your child got it from someone and they can pass it on. And three, this is the big one, it needs antibiotics, unlike a lot of viruses.
Right, so it's not just wait and see.
No, definitely not. That's why parents are so concerned, and rightly so. It needs specific treatment.
Okay, but here's a twist I found interesting in the source. Strep causes the sore throat, the fever, sure, but it doesn't cause everything people might think, like maybe not a cough.
That's a really key point. It doesn't usually cause those classic cold symptoms like a runny nose or a significant cough.
So how does a pediatrician sort through it all? A sore throat could be so many things.
Well, that's where their supercomputer kicks in their brain, their training, their experience. They make an initial judgment, sort of weighing the odds based on specific clinical signs and symptoms. Knowing what they look for helps you understand the process.
Like being a medical detective. I like that. Okay, so what are some of those big clues you look for? What stands out from the source?
Okay, first up, headache. A sudden headache, and it's often described as generalized, not just in one spot. That makes strep more likely. The source mentions a positive likelihood ratio, the PLR, of up to 2.6 for this one.
So not just any headache, but a specific kind. Sudden and all over.
Exactly. Then there's muscle aches and pains, myalgia. Strep can really just knock a patient flat. Little kids might not say, my muscles ache, but you'll notice, right? They just want to sleep. They're suddenly glued to the couch. Total lack of energy.
Yeah, the couch potato sign.
That's it, that general systemic feeling of being unwell. The PLR there is about 1.2, so it adds to the picture.
Okay. What else? Fever seems like a big one.
Oh, fever is major. Lots of strep infections come with fever, sometimes quite high. And even if you've given, say, Tylenol or ibuprofen before the visit.
Right, to make them feel better.
Exactly. The doctor will ask if they felt feverish, if they had chills or hot breath. That history is important. Fever is a strong indicator, PLR up to 3.9. So yeah, pretty significant.
That's good to know. Tell the doctor even if the fever's down now. Okay, what about looking in the throat?
Right, the visual inspection. Seeing goopy stuff in the throat, that's technically tonsillar or pharyngeal exudates. Think white or yellowish patches on the tonsils. That's highly suggestive of strep. Now, some viruses, like mono EBV, can cause it too.
Okay.
But it definitely pushes strep higher up the list and usually prompts testing. The PLR here is up to 2.3.
Gotcha. So it's a strong hint, but not definitive on its own.
Precisely. And related to that, swollen cervical glands, those tender lumps in the neck. Feeling those, especially if they're tender, and especially if you also see the exudates. That's very suggestive of strep. It means the immune system is fighting hard right there. PLR is up to 2.9 for that.
Okay, so those are all things that point towards strep.
Right.
But you mentioned earlier something about what's not there being important.
Yes, this is crucial. The absence of cough.
No cough.
Generally no cough. Most viruses that cause sore throats also bring along a cough, maybe a runny nose, hoarseness. Strep usually doesn't. So a sore throat without a cough, that makes strep more likely. Again, never say never in medicine, but it's a pretty good differentiator. PLR up to 1.7.
That's fascinating. So the lack of a common cold symptom is actually a clue for strep.
It really is. And one more factor, exposure. Has the child been around someone with confirmed strep in the last couple of weeks?
Oh, right, because it's contagious.
Highly contagious. Now, often you don't know this information, but if you do, say a sibling had it or there's an outbreak at school, that makes the diagnosis much, much easier. It significantly raises the suspicion. PLR is up to 2 if exposure is known.
Okay, so putting it all together for you, the listener, knowing these specific things, the type of headache, the muscle aches, fever history, the throat appearance, swollen glands, no cough, and any known exposure, Helps you give your pediatrician really useful information.
Exactly. It makes the whole process more of a team effort.
Right. So the pediatrician gathers these clues, runs the supercomputer, and then what?
Uh-huh.
Testing often comes next, right? The rapid test.
Yes. Usually, if the suspicion is moderate to high based on those symptoms, the next step is often a rapid strep test. It's fast, you get results in minutes, and it's pretty good. It's positive 90 to 99% of the time if the infection is actually there.
90 to 99% positive sounds really accurate.
It is. For picking up positives, if it's positive, you can usually start antibiotics right away.
But I sense a but coming. What if it's negative? I've heard sometimes they still do another test.
That's the crucial point. If the rapid test is negative, but the doctor still has a strong suspicion based on those clinical signs we just discussed.
Like the fever, the exudates, no cough.
Exactly. If those signs are strongly pointing towards strep, they'll typically order a backup test, a throat swab culture.
Okay, why the backup? If the rapid was negative, is it just being extra cautious?
It's more than just caution. It's about safety and accuracy. The culture is kind of the gold standard test. It takes longer, maybe 24 to 48 hours,
Right.
but it's even more sensitive than the rapid test. The main reason, though, is to prevent potential complications from missed strep. The American Academy of Pediatrics recommends doing the culture if suspicion remains high after a negative rapid test.
Complications. You mentioned that earlier. What kind of complications are we talking about that make this backup test so important? It sounds serious.
It can be, although it's rare now thanks to antibiotics and good diagnosis. Untreated or improperly treated strep can, in some cases, lead to serious issues down the line. Things like rheumatic fever, which can damage the heart valves, or a kidney problem called post-streptococcal glomerulonephritis.
Wow. Okay, so missing it isn't just about a longer sore throat.
No, absolutely not. Those potential long-term risks, even if low, are why being thorough with diagnosis is so critical. That confirmatory culture is really key for patient safety when the signs are strong, but the rapid test is negative.
That makes so much sense. It's about protecting against those rare but potentially severe outcomes.
Precisely. It's that collaborative decision-making, using the best available tests to be sure.
It's really striking how much goes into diagnosing something that seems so common. It's definitely not just a quick glance at a red throat. And for you listening, understanding this whole process, the symptom clues, the testing sequence, why the culture might be needed, it really empowers you in those conversations with your pediatrician.
Absolutely. And stepping back, it just underlines how important careful observation, critical thinking, and using the right tools are in medicine. It's about applying knowledge effectively for the best health outcomes.
Well, we hope this has been really valuable for you getting into the weeds of strep diagnosis. For much more on this and just a ton of great pediatric health information, you really should check out omegapediatrics.com. They cover everything from illness to checkups. That's OMEGAPEEIATRICS.com. Definitely worth a visit. And hey, if you found this useful, do us a favor. Like this video, subscribe to the channel so you don't miss our next deep dive, and share it with other parents or anyone you think might benefit.
Thanks so much for joining us today.
And thank you for listening to Have More Babies. We'll catch you next time.